So I'll be talking about aniridia and with macular hypoplasia. So why this topic is chosen, why I chose this topic. So aniridia is a rare genetic condition of the eye in which there is a partial or complete absence of iris. It is associated with fragile capsule, hypoplastic iris and glaucoma, making it complicated case for cataract surgery. Surgeons are reluctant to operate such cases because they are prone for the more complications. The purpose of this case study is to discuss strong genetic link in aniridia patient, validate the fact of it is a rare condition. Emphasis on need to operate patient for cataract surgery. So we had a 13-year-old female presented. She residing at Barshi, Maharashtra. It is presented in ophthalmology OPD with a history of brain PPG DOV since 1 year. Her loss of vision in the right eye was more than left eye. She had photophobia for 7 years. On the clinical examination, she had complete aniridia in both her eyes, and there was a developmental cataract in both her eyes. So we did the further investigations, and her IOL scan was a 29.5 in the right eye and 29 diopter in her left eye. So a detailed ocular history, then slit lamp examination, gonioscopy, fundus examination, intraocular pressure, and a B scan was done. USG abdomen also carried out for urogenital abnormalities. Decided to do a phaco with a foldable IOL under local anesthesia of the right eye first, and all the steps were done nicely. Then after putting the lens, the wound was closed, and she had post-op vision 6/12 unaided. So if you can make out, there is a complete aniridia. This is a right eye cataract, the left eye early cataract. After post-operatively, day 1 we put the air bubble, and okay, now this is her mother. She had both eye pseudophakia, and her mother is operated at the age of 20 years. So vision increased from finger counting close to face to 6/12 and 2-line visual impairment due to macular hypoplasia. So to conclude, a detailed history, ocular and systemic investigation in family members of aniridia patient is strongly recommended. Aniridia patient, they can have a normal vision post cataract surgery with a special care, and there is no financial disclosure. So what is aniridia? It has cataract, glaucoma and the corneal abnormalities. Vast majority cases, they occur isolated without systemic involvement due to deletion of paired box gene 6, that is PX6. It can also occur in minority of cases as a part of WAGR, that is Wilms tumor, aniridia, genital abnormalities and mental retardation. It is sometimes due to adjacent PX6 or the Wilms tumor gene if they are both deleted. Individuals with WAGR have a significant risk of developing Wilms tumor and childhood kidney malignancy. The prevalence of aniridia is 1 in 40,000 to 1 in 1 lakh. So what are the phenotypes? Isolated aniridia without systemic involvement, WAGR syndrome and Gillespie syndrome. They come up with the various and different presentations. So aniridia type 1, that is 85%, and it is familial aniridia, autosomal dominant with incomplete penetrance and expression, and it is a isolated, they come out as an isolated ocular defect also. So aniridia type 2, that is a 13% Miller syndrome. It is sporadic, non-familial aniridia and Wilms tumor, deletion or mutation in short arm of chromosome 11. It is associated with Wilms tumor, genitourinary abnormalities and mental retardation. Craniofacial dysmorphism. Then aniridia type 2, it is autosomal recessive aniridia, mental retardation, cerebellar ataxia, structural defects in the cerebellum and brain, and it do not develop Wilms tumor. So I would like to say thank you to everyone for your patience, and if you have any doubts or questions, we are open to, you are free